Thank you for being with us. This is Khalil Hachem with the Michigan.com grant to help prevent substance abuse in our community for youth. And 4 organizations have received it. Representatives of those, 2 of those organizations are with us this morning to talk about the grants, what they do, and what they're going to do with them. We have Hala Mallah, Public Health Coordinator, Substance Use Prevention with Access. Hijazi, Community Engagement Manager with Access as well, and Mara Phillips, Drug-Free Community Project Coordinator with LAHC, and that's Leaders Advancing and Helping Communities. Good morning to you all.
Good morning.
Thank you so much for being with us. Let's start with Hala and Mona, and then we can move to Mara. Just tell us a little bit about what you do and how important this money is and what are you going to do with it?
Sure. Thank you so much for having us this morning. Good morning to everyone on the call. So the coalition is the ASAP Community Coalition, and it is a drug-free communities coalition that is the grant is through the CDC and wnzk. And through this funding, we are looking at 2 goals, which is to reduce substance use and to increase community collaboration. These 2 go hand in hand. So our coalition consists of stakeholders from within the community. So you have to have individuals who are on the ground. So for example, we have our schools, which is a lot of our work is done heavily in the schools, parents, youth, law enforcement, people from the business sectors, healthcare professionals, people who are in recovery themselves, people who work in treatment as well. And so we have a variety of individuals that we come together and we meet every single month. Outside of those monthly meetings, we are doing activities and action plan items together, which consists of a variety of different awareness campaigns. So, for example, we have a lot of heaviness right now on social media. We have a lot of media campaigns in the community, including billboards. We have partnered with an organization to have translated resources. So our resources are translated into Arabic as the population that we serve is the Dearborn and parts of Dearborn Heights, which is a heavily Arab American population. And then a lot of our work consists of working with our schools, which is providing health education presentations within the classrooms, also parent presentations that we do bilingual. And that includes talking to them about substances of tobacco use, which is a huge, as you guys know, tobacco use in our community is very heavy. And then opioid prescription drugs. A lot of it is not only what happens to the person, but also how to prevent it, the use of it or the abuse of it. And then marijuana as well. When it comes to marijuana, we talk to the youth about how even though marijuana is something that is now legal, it is not legal for the youth to be using. One of the issues that we see within the schools is vaping as well.
Hala, you want to add to that, please?
Of course. And so to talk about some of the goals with our work, I would say that one of the main parts is to raise awareness about the substance use in the community, and then also to help prevent it from starting in the first place for any youth, especially who might not be using substances. And then any youth or anyone really who might be at risk for maybe trying these substances later on, we really focus on teaching them the skills that they need to make sure that they know how to stay
Recording in progress.
And then they know how to refuse them. So if their peers try to pressure them, they have the right self-confidence, the right decision-making skills to say no. And then that's really what we focus on with the education. And then one more goal I would really say is that this work really allows us to put the community on the map. It really lets us represent the entire community as well as the Arab American community too. This population is usually under-recognized. There isn't really too much known about the community, especially with substance use. So we really like to focus on having these conversations, representing the community, and making sure that we're doing this new research to see how can we help the community better, and then what areas are still missing. So we know there's a lack of information and data about the community. So this work allows us to be at the center of it and to really start this research and to partner with others who are doing the research. So with the academics and the universities. So this work really does set the ground for new future work with the community and to help really save the lives as many people as we can.
Wonderful. Ms. Phillips?
Yes, and something that I like the most about the DFC format is that what Mona mentioned, having all of the sectors of the community involved in that conversation, because the law enforcement sector may have some different ideas about how to address youth substance use than maybe youth in the community or schools or parents. So having all of those sectors represented really allows us to have the most holistic approach. It allows us to have the most experiences and the most resources at the table in order to address this problem. And similarly to what they had mentioned as well, a lot of the programs we offer address the beginnings of substance use, right? Because we are prevention. So we address things that may lead to substance use in the future, like teaching healthy coping skills, teaching how to have a positive self-image and how to have difficult conversations. And we have those programs with youth, we have those programs with parents as well. But ultimately we're trying to, provide information, enhance skills, provide support as well, and reduce those barriers that are keeping people from either being involved in this or just keeping people from taking a look at their own lives and their own families as well, and kind of taking that information and taking their own experiences and bringing that to the table and helping other people with that.
Absolutely. Is this your first program at LAHC?
We have
LAHC, I should say.
Yes, we have a substance prevention program at LAHC that serves all of Wayne County, and that's been in existence for quite a while with the organization. But the ACT Drug-Free Community Coalition, which is the recipient of the DFC grant, that is relatively new. We're in our third year, and we provide specific focus in Dearborn Heights and Inkster.
Mona, when we're talking about substance abuse, what are we talking about?
That's a very good question. There's so much there, right? I mean, you can look at it from the prevention aspect. You talked about this earlier. The age of a youth has gone down to 12 years old for the first time that they actually try a substance. So we are really looking at how do we prevent that? How do we increase the number of in-classroom presentation, conversations, and not only from us talking to the youth. One of my favorite parts of our coalition is our youth group. So we create these young ambassadors and these young individuals in the schools that work on action plan items within their schools as well. So for example, they did a lot of research themselves around tobacco laws, about PUP laws, about compliance checks for vendors. And from that, they put together a wonderful presentation that was recognized in front of the City Council of Dearborn and Dearborn Heights. When we look at substance use treatment, we look at not only just substance use, but substance use is something that could be co-occurring with mental health issues as well. So you do want to take a holistic approach when you're looking at someone's treatment. Now, when you look at your partners that are on the table, when you get a grant, there's never a time where everything that you have to turn into that grant funder is the only work that you do. There's always so much out of the box work that has to be done because you are working in a community and you got to listen to your community and you have to accommodate your community. So for example, after COVID, after the big couple years of COVID of course is still around. Our schools struggled so much with kids coming back into the school system and working and being among their peers, and a lot of it was just social isolation. A lot of them became very addicted to gaming and to being on the computers, and so we had to accommodate our schools and talk to the kids about that and really work on their emotional skills. So it's not only just what the grant is providing, because I'm going to be honest, I don't think there's enough funding for this work, right?
Exactly.
I mean, substance use and mental health is one of the number one issues in our communities. And when we looked at this particular funding source, our main goal about it was just to support our community. And when we went to apply for the funding source, actually, because I serve this particular area, of course, Access serves all the tri-counties, but this particular grant makes you serve particular zip codes. And the zip codes that I'm serving is a high population of Arab Americans. And as Hala mentioned, we're very under-recognized. Yeah. And in the United States Census, we are considered white. And so there is not a lot of research that comes to the table for you to go after funding. So for the first time that I applied for this particular funding, I didn't get it. And then I had to go back and think about how can I really show what's going on in our community. And we had to do our own data collection by going in the schools, doing focus groups with the parents, talking to students, and unfortunately getting some personal stories from individuals who have lost loved ones to substance use and mental health. I actually lost my brother to substance use in 2019. So this is something that is very personal to me. This work that I take on is really because, one, I trust in the agency that I work for, and I know that they are going to make sure that we provide the utmost support for our community. And two, I'm from this community, and I'm raising my children in this community.
Absolutely.
And so I really want to make sure that I am being a voice for this community. And actually right now, Hala and I are at a national conference, and we are representing our community, and we're finally showing who are the Arab American communities and what is the work that's being done within the Arab American community. So there's a lot of different varieties, I would say, when it comes to substance use, but I do want people to understand that addiction is a disease, and it's not something that people decide and choose. And one thing that we always have to think about is we do need to focus on the stigma that is creating a lot of barriers.
Exactly. That was going to be my second question. Yeah, it's going to be I would like to ask Hala to tell us, what are we talking about? Are we talking about smoking? Are we talking about alcohol? Are we talking about drugs? When we say substance abuse, and what age group are we talking about?
Sure. So with substance misuse, I would definitely say that when we're talking about this issue, it's bringing awareness to when someone is using the substances for the wrong reasons. So maybe it's to self-medicate, to deal with some sort of mental health illness that's going on, or maybe because they're being pressured into it, or maybe because of their environment and their peer pressure. So anytime that these substances are being used in the way that they're not supposed to be used, so especially with prescription medication, they're legal, they're prescribed by a doctor, but if they're being used for the wrong reasons, if they're being used from someone else, if they're being used by the youth, and then also other substances. So we are also talking about tobacco, for example, with cigarettes, vaping, hookah, in any kind of form. It's also marijuana. So especially it's going to look different because now, if anyone's 21 or older, they can smoke cigarettes legally. But if it's a youth, that's a whole different issue we're talking about. Now we're talking about the legal trouble you can get into. We're talking about how it can affect the body for younger children or for the youth much more than adults. The brain is still not developing, especially under 21. So any youth is more likely to become addicted, especially when they start vaping. We like to tell them, even if you try it once, even if you take a few puffs, you could become addicted just from that. And they're much more likely to be addicted as well. We also talk about, so we do cover alcohol as well with these presentations. We cover any kind of substances that are becoming more known in the community, that are really affecting the community in a strong way. So whatever is coming up, whatever is trending now, anything that's affecting the community, we're going to be there. The schools tell us, this is an issue in the school, please come speak to our youth, please speak to the parents. So this work is always changing, it's always adapting, because life in the community, it's changing every moment. So we have to constantly update everything that we do.
Mara, do we talk to the parents, and how can we educate them to really recognize the signs and be aware?
Yes, we have a nurturing parenting program, actually, which is a family-centered, trauma-informed initiative designed to build those nurturing parenting skills. So when we're talking about substance use in the community, we're not just talking to youth about youth substance use. We're talking to the entire community, and especially to parents and to families. And that goes hand in hand with our Botfin Life Skills program for youth. So we're teaching those same skills. We're talking to parents about how to have difficult conversations because it's hard to talk to your kids about substance use.
Sure. What we're going to do is, if you don't mind, we're going to take a short break for a commercial, and we'll be right back. We're going to be talking about the stigma, and specifically in our community, it's huge, and how we can overcome that. Please stay tuned.
Imagine you're on a train track, somewhere miles away. A train is headed your way. You can't see it yet, but it's coming, slowly but surely. If you have prediabetes or you're at risk for type 2 diabetes, you may be on the wrong track, and diabetes could be heading your way. Bit by bit, the danger is getting closer and closer. So should you stay on the track you're on now, or move to make a change and reduce your risk? If you have prediabetes or you're at risk for type 2 diabetes, you may qualify for the National Diabetes Prevention Program in your local community. This one-year program could be the ongoing support you need to put you on the right track. Not only did participants lose weight, they cut their risk of type 2 diabetes in half. Ready to get on board for a healthier future? Learn more about the National Diabetes Prevention Program and what else you can do to manage and prevent diabetes at michigan.gov/diabetes. A message from the Michigan Department of Health and Human Services.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shama is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shama has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shama is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shama at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
Are you going to start a restaurant or grocery store soon? Do you need floor plans and designs? Call Najee Abood at 734-744-9796. Do you want to buy kitchen and restaurant equipment at discount prices? Call Najee Abood now, 734-744-9796. New Concept Products and Design, the trademark of kitchen equipment. 5% discount on all purchases of $75,000 or more. New Concept Products and Design, new location, 31185 Schoolcraft in Livonia. Learn more at www.newconceptproducts.com. Call Najee Abood, 734-744-9796.
Enjoy the first Syrian-style cuisine in Michigan. At Damas Cuisine and Catering, you'll find a wide selection of Syrian foods and sweets in our menu, like frikeh, hoisin, grape leaves with steak, mashawi platter, hot mahashi, char-grilled kebab, shawarma, and much more. Get super fast delivery from Damas Cuisine and Catering right to your door. Order online at damascuisine.com/menu and track your order live. Damas Cuisine and Catering, 28841 Orchard Lake Road in Farmington Hills. Call 248-987-4985.
Welcome back, and thank you for being with us. This is Khalil Hachem. We're talking about how to prevent substance abuse, and it's a very important topic in our community. It involves our kids. It involves educating the parents. It involves many different facets. What started this is a grant to 4 organizations in Southeast Michigan that would get money for these education. One of the issue that is huge, specifically in our community, is the stigma. How do you talk about this? How do you convince parents that it could be your child? It could be us. And when people are dealing with it, they want to keep it hush hush instead of saying, no, this is happening to me. It could happen to you. How do we deal with that? Anyone, if you want to take, should I
start? Yeah, go ahead. Yeah, that's fine. I think that when we looked at how are we going to address substance use and mental health in our community, stigma was one of the top ones that we looked at. And so that's why we said, okay, let's do some education around it, right? Let's explain what is addiction. What does this look like, right? And one of the things that we always talk about is there's no face to it. It really could be anyone, and it could be anyone's child. And so we talked about, a lot of the work that we had to do was about education. And the other portion of it is, we had to do the research on it. Like, what is the reasoning behind stigma? I'm working on a project right now with Wayne State University on that, on understanding, where does that come from? Why are people, what are the barriers that's causing individuals to have it? And a lot of it comes from lack of knowledge. A lot of it comes from what the United States has created on the media platform of what addiction looks like. What does that mean in the past history of the drug pandemic throughout the United States and throughout the world? So when you want to bring it back home, you got to, really make it understandable for individuals. I would have to say that a lot of it also comes from people not even knowing what mental health is and what depression looks like. That's something that, people don't talk about. We also talk to people about having conversations with about their own health. I think health in our community is something that people are not very comfortable talking about. It could be physical health, mental health, community health, and so, we really need to create that by, for example, one of the things that we found was people go to faith institutions. So we had to talk to our faith leaders about educating them during their sermons, talk to the community about that, hold the events within, one of the things we used to do is instead of having people come out to us, to our building or to our events, we would go to them because then we can destigmatize. We meet people where they're at. At the end of the day, if it's for prevention, if it's for treatment, at Access, we meet people where they're at. I do want to tell you that from this program, from this coalition, from a lot of the work that we did, we have partnered with the Dearborn and Dearborn Heights Police Station, and we provide a quick response team that goes to the people's homes. So it's one of our team members with a police officer that goes to an individual's home who has a history with the police. So if they have a police record for mental health or substance use, we go out to their home, we meet them where they're at, and we provide them a treatment option. You really got to make sure, we're always very busy. I think one thing that we don't do is campaign enough what we do. Exactly. We're always, I think sometimes people are not aware of everything that we do because we're just so busy doing it. And I can tell you right now that our advocates that are going into the homes, you probably don't know about that because we don't publicize people's faces about what they're doing, so we don't want to,
which is okay,
yeah,
as long as we get the results.
Exactly. That is the whole point, is to get people into the right places. Right. Another thing about stigma with mental health and substance use is that we need to understand that people do recover and that they're welcome back into the community.
Absolutely.
I do want to say that stigma for, on a personal level, I think stigma was one of the number one issues my brother faced, is feeling like he didn't belong, feeling like he shouldn't be in the community, feeling like he's being judged, and I come from a very well-known family in the community. So that was very difficult for him. But just to show you, I have 11 siblings and we have physicians and people like myself who work in this work, and I still lost a loved one to substance use. So just to show that really stigma can be a huge barrier for individuals, and we want to break that. And there's people who are in recovery that are living and have families and are doing really well, and we want to recognize them.
Absolutely. Mara, how do we talk to parents?
By talking to parents, again, reducing that stigma. Something that we try and do is remove morality from that conversation, because addiction is a disease. It can affect anybody. It is a mental and physical health problem. It's not a testament of a moral deficiency in any way. So we try and humanize that experience, right? Something that we do in talking to parents and youth and the community in general is we have coffee chats. So we just really sit down really casually and have coffee and have a conversation with specialists in the community as well as people in recovery. And that's something that we've seen a huge reduction in stigma and kind of start that conversation because our community is seeing people who are in recovery, a lot of times people who got sober young, so had to navigate addiction and kind of go through that very young and talk about what that was like for them and where they are now. And like Mona said, a lot of these people have families. They're very successful in the community. They feel very supported. So in reducing that stigma, we're trying to give those people a platform to say, look, people can recover, they do recover. So we should address people with addiction with that same humility and with that same compassion that we do once they're recovered.
Hala, what can we do as a community to help you do what you do?
So I would, a lot of things that I could mention would be to allow these conversations to happen in a way that's easily met. So again, reducing that stigma so that we're more welcome to speak about these issues. People are more open to the messaging of it, and to know that we're here to be helping. We're here to teach life-saving information. We're not here to teach anything that's negative or that's harmful to the community. It's the complete opposite of that. And really just continue to support the work, spreading the word about the work that we're doing, welcoming it, and really just having more conversations, I would say. So whether it's with the parents, whether it's the youth, really destigmatizing this topic of mental health, and as much as we can to spread awareness about mental health and speaking about it in many of the ways that everyone here has mentioned so far. Just making them regular topics that we should be discussing.
And I also like to mention, I mean, mental health doesn't mean that somebody is crazy. Mental health means that somebody is facing certain issues that can be addressed and they can move on. Because in our community, more so than other communities, when you bring this subject or the topic of mental health, or you tell somebody that, you may need counseling or you may need to talk to somebody, the first thing they say, I'm not crazy. It's not about being crazy. It's about needing help, needing maybe just to talk to somebody, somebody to listen to you, somebody to explain to you what the fundamentals are, and then going back to them. Now, do we have enough supporting programs? Because, you can get somebody out of trouble, but if you don't have supporting programs, that journey may not be as good as it should be. Do we have enough supporting programs? Mona?
So are you talking about when someone's going into treatment?
Yes.
Yeah, I mean, is there enough? That's a very difficult question. Sometimes I could say people can get into bed, can find beds in inpatient. Sometimes there's a lack of beds. I mean, it really is. The healthcare system is a very difficult system to navigate. So in Wayne County, what you have to do is you have to go through the Detroit Wayne Integrated Health Network, which is 1-800-241-4949. And the person has to call, and then they have to do an assessment over the phone, and then they have to go from there. So we're not very comfortable with telling someone, call that number. Sure. We prefer to sit with the person and to help them call that number, because if someone is at that point where they're willing to get help, they're not in a state of mind to be doing that alone. They need that support. It's all about supporting that individual through their recovery process. So it's really got to figure it out. Like I said, if we have to go to their home, then we go to their home. If they want to come to our agency, then they come to our agency, and then they're linked to a case manager, a therapist, a psychiatrist if needed. I mean, it's a holistic approach. So once you do get that individual into treatment, then you need to do the follow-up care. So they either need outpatient treatment, which we have over 100 mental health individuals in our agency that work on these clients. And then sometimes they need clinical. Sometimes they're even ready to get back into work. So we link them to someone who can help them find a job in the community. We even educate our local businesses about hiring people who are in recovery. Our agency ourselves, we hire individuals who are in recovery. And then you also have to think about people who have severe mental illness, right? So where are those people going to go? So, we make sure that they get linked to our clubhouse, which is a place for them to be at all day. So there's so many different, there's no one perfect picture for an individual. There's no one treatment option. That's why there's so many professional assessments that have to be done for the individual to figure out where they should be in their process. It's not an easy thing to decide to go into treatment. It's not an easy thing to go to the doctor's office, right?
Absolutely.
Some of us are scared to go to the dentist. So how can we expect someone who's needing treatment to be doing that on their own? And that's not what we're about. We're really about that warm handoff. Even during COVID, our team was fully PPE safe and would go outside the individual's home and help support them. And I really do want to make sure that people understand that therapy is very important. Support groups, family support groups is very important. And just really knowing that you're not alone. If you think that you're alone, you're not. If you think that you're the only family going through this, you're not. We've seen the number of funerals in our community, and we really want to stop having those in our communities.
Sounds good. Is there anything, I'm going to start with Hala. Is there anything I haven't asked you that people need to know? And how can people reach you if they need help?
Sure. So I can speak, because a lot of the work that I do is with the youth and education. So I can speak on that these youth, these high schoolers, these middle schoolers, they volunteer with our program as well. And they do a lot of education for their classmates. They talk about mental health and substance misuse. And so to take them seriously, to really listen to them when they speak, because their messaging is so powerful, their experiences are so powerful. So don't underestimate the youth, especially when they're speaking about these issues, because they witness it in their peers. And these are the people we want to save and protect, and really equip with all the skills that they need. And if you do need to reach me, I do have an email address. I can either give that to you, and I can say it out loud right now as well.
Go ahead. Let's do both.
Okay. It's HMALLAH@accesscommunity.org. You can reach me by email, and I will be more than happy to respond for anything that's needed.
Wonderful. Mara?
Yes, kind of echoing what Hala said, I want to highlight our youth that are involved in the coalition. Our Youth Action Committee is a group of some of the most brilliant people I've met, genuinely. So I would just urge listeners to really listen to the youth in your lives when they're talking about substance use, when they're talking about the problems that youth are facing in the community, because our youth guide a lot of what we do as a coalition, because nobody knows the problems that youth are facing more in the community than they do. So really listen to them, and if you have a platform to give youth, give them that platform, because they are the people who are really taking actionable steps to make a difference in their own lives, but also for the lives of everybody in the community. And you can reach LAHC, Leaders Advancing and Helping Communities, at 888-315-5242. Or you can reach out to me directly at mphillips@lahc.org, where our phone lines and our emails are always open for anybody.
Thank you. Mona?
Yeah, I'm going to add that if you are, or someone you love is looking to get some help when it comes to substance use or mental health, please first, if it's an emergency, you always call the emergency numbers. If you want to talk to someone from our mental health team, you can call Access at 313-945-8138, 313-945-8138. And then my email address is Hijazi, Hijazi, @accesscommunity.org.
Guys, I want to thank you so much for being with us today. This is a great topic and a very important topic to relate to our community. And please keep us in mind if there is any issue that the community needs to know. We're always available here to work with you. It would be great to get somebody who has gone through this and tell us some success stories, because these people can inspire a lot of youth. I understand that, you know, there are a lot of stipulations because of the age and all of that, but if they agree to it, we'll be more than happy to do that at a later time. Thank you so much for being with us.
Thank you.
Absolutely.